My name is Haley Glover, and today I will be talking about African trypanosomiasis. What is it? So, African trypanosomiasis is caused by a parasite known from the group Trapezoma. And in the bottom left corner, which is pictured right here, you can actually see the parasite. The disease also has a nickname, and it's called the African sleeping sickness. And you're probably wondering how the disease spreads. Well, this is where the tsetse fly comes in, which is pictured right here. This is the fly. So over the period of time, deaths increase throughout years, but on an average, it's 100,000 people died each year from this disease. Only because the tsetse fly comes around and attacks the human by biting and releasing the parasite into their body. The fly and disease come from sub-Saharan Africa, which is pictured right here in the right corner. On this slide, it shows the tsetse fly stages and how it attacks the body. So, it starts with the tsetse fly takes a blood meal, and that's when the fly attacks the human body by biting it. It doesn't matter where it bites it at, but on this picture it shows that it bites it on the shoulder. It shows that the tsetse fly releases the parasites into the body, and then the parasites go into the blood stream and also into the spinal fluid. After a period of time, the parasites multiply and take over the whole entire body. The main two. So you have Trapezoma brucei gambinus and Trapezoma brucei rhodinus. Trapezoma brucei gambinus is from West Africa, and Trapezoma brucei rhodinus is from East Africa. They're both named only because of what region of Africa they're from. Symptoms. Early signs. So when you have African sleeping sickness, you have early signs of skin sores from where the fly bit you. So that is called a tryposa canker. And it usually comes around after a week after you've been bitten, and it's very painful. And also when you touch it, it's like a rubbery feeling. After 6 to 8 weeks, usually you'll have a rash around it, causing more problems to your body and to your skin. More symptoms. So, when the parasites go inside your body, it makes your lymphatic system bad. The inflammation of the nodes is lymphaditis, and usually that is caused by the parasites going inside of them. You can tell here by the inflamed lymph node and the normal lymph node. More symptoms. So, of course, you'll have more symptoms when you're getting bitten by a fly. You'll have mood change, fever, weakness, headache, insomnia at night, weight loss, and sleeping for a long period of time. And sleeping for a long period of time, that's why they call it African sleeping sickness. More symptoms. Most people can treat the infection like in the early signs only because of the wound that's presented. But if you have a late infection, that's just not good at all. Usually the central nervous system is attacked and it causes way more problems than it should be. And if it's untreated, mortality rate is 100%. Also, your white blood cells elevate. Diagnosis and treatment. So for diagnosis, you'll have 3 options. Usually you'll have more, but these are the 3 top options that people recommend. So blood smear, tissue aspirate, and spinal tap. So for the blood smear, that's usually what people get when they have African sleeping sickness. That's when they take your blood from your body and they put a sample underneath the microscope and view it to see if you have any parasites in your blood. Because the parasites go into the bloodstream and also into the spinal fluid. Tissue aspirate is the next one. That's when your lymph nodes are swollen and they check around the tissue, and they see if anything is wrong with that or what's causing the inflammation of the tissue. And spinal tap will be the last one. That's when they take some fluid from your spine, because the parasites are in there, and they record what's going on to see if you actually have African sleeping sickness. For the treatment, you'll have 2 options for both. For Trapezonia brucei gambinensis, it's either you have an early infection or you have a late infection, and you'll never want a late infection. But for early infection, you'll take medicine called pentamidine, and for late infection, you'll take eflornithine. And for Trapezonia brucei rhodesiensis, early infection is for ceramine, and late infection is melarsoprol. And usually people figure out if they have the sickness because I've talked about it already with the sore. So it's easier to get the early infection medicine than having the late infection medicine.